Hey, I'm Dr. Kreitzman. I'm an anesthesiologist with Metro Anesthesia Consultants in Phoenix and Scottsdale. So the purpose of this video is to explain what an interscalene block is and have you understand the procedure, the risks and benefits, and enable you to make an informed decision about whether you'd like to have one prior to your surgery. An interscalene nerve block is basically an injection of local anesthetic around a group of nerves. Okay, in this case, the nerves are the brachial plexus nerves, which run from your neck down under your clavicle and out to your arm. And these nerves provide sensation and motor function to your arm. The interscalene nerve block is typically used to provide pain relief for surgeries on the upper extremity, whether it's from the shoulder, elbow, forearm, or hand. So procedurally, what we'll do is we'll give you a little bit of medicine in the IV, which is a sedative that'll make you feel comfortable and relaxed during the procedure. We'll do the procedure in the pre-op area, and then once that is complete, we'll take you back to the operating room and have you go to sleep under general anesthesia. We will use a device, one or more devices, in pre-op to identify those nerves and make the injection safe. Those devices might include a nerve stimulator or an ultrasound machine. Two of the most common side effects with this block are potentially a droopy eyelid and a pupil that may be different from side to side. That's called a Horner syndrome. It's not dangerous, it's just part of the block. That will go away over time as the block wears off. As well, the breathing muscle on that side may fall asleep. That isn't a danger to your breathing, but then that will wear off as well. The benefits of the nerve block are obvious. You will have a numb arm for 16 to 30 hours. This means that you'll require less general anesthesia, fewer pain medicines in that period. Your time to discharge will be quicker. You'll probably be able to eat sooner when you get home and hopefully just get on with your day.
When I did wake up, I was obviously still a little groggy, a little tired, but I couldn't feel anything on the right arm at all, which was great because I was expecting to wake up and feel a lot of pain right away and just be uncomfortable. But it was actually quite the opposite. It was kind of nice.
When the pain block started wearing off, I could tell it didn't just come on. Sometimes Dr. Berkowitz warned me that it would come on and feel it right away, and it kind of came on gradually. So I was able just to take my pain medications and tolerated that pretty good.
The risks of the block are related to using the needle. Those are bleeding, infection, and toxicity. The most dangerous of them is toxicity. So we do not want to inject this medicine into a blood vessel, and thus we're very careful. We take our time, we inject incrementally, and we use several instruments to help us verify that our needle is in the correct location.
Really, I wasn't aware of the nerve block until right before. And the doctor came in and kind of really discussed it with me, kind of walked me through the procedure and the benefits, the pros and the cons to it. Kind of helped ease my mind quite a bit regarding it.
Going into surgery, I had a lot of anxiety, worried about the anesthesia. I always worry about that. Even though I'm a nurse, I worry. And there's, the regular wondering if everything's going to be okay. When I came home from surgery after the block, I had no pain. I think my surgery started around 10 a.m. I didn't feel anything in my arm at all until about 6:30 the next morning, so almost 20-something hours.
Patients are encouraged to ask questions of their anesthesiologist during the pre-op visit to see if the interscalene nerve block is the correct choice for their post-op pain relief.